first off is visual inspection of your breast. As a man as well, but you know that shirt and bra removed and you are standing in front of a mirror. I have a diagram. So side and your arms are down, right? So you when your arms are down and by the side, you raise your arm high above your head and do the same thing. Like when you look at, let me start again. You remove your shirt and your bra, you are in front of the mirror, right? You stand in front of the mirror, you put your arm down and by the sides. Look out for any change in your breast shape. Look out for any breast swelling. Usually, I do know that most women or everybody, not just most women, have one part of the breast larger than the other. That's a normal instance. But then you would know as an individual when your body is no longer normal, when there's an extreme or abnormal swelling. So you look out for change in the breast, your shape of your breast, for breast swelling, for dimpling in the skin, for nipple discharge, for retracted nipples. I know that there are people that have naturally have retracted nipples, but let's say you've never had retracted nipples. All of a sudden your nipples start retracting. What I mean retracting, I mean going back inwards. Then there's an abnormality somewhere, right? So the first thing you do in breast self examination is checking your breast physically with your eyes first before you now proceed. Now, starting from, let's start from your left breast. After you must have done the one by where you use your arm by the side of your body, you now raise your left arm up above your head, right? When you raise it up above your head, you're able to inspect and still check for your breast, for the breast swelling, for the breast shape, change in breast shape, for the dimpling in the skin, and the rest of them. Finally, you we did that for the left breast, so we're also going to do that for the right breast. Finally, you put your hands on your hips and press firmly. Now what you're pressing is for you're pressing your nipple for discharge to check if there is blood coming out, if there is pus coming out, if there is abnormal liquid, whatever color it is coming out, it should depict that there's a problem somewhere, especially if you are not breastfeeding. Now, I mentioned that there are three methods to it. So we just talked about visual inspection. So we are going over to manual inspection while you are standing up. Now, just like I said earlier, you use your right hand for your left breast and your left hand for your right breast. And there are various methods to this. Now, I think I jumped something. For every woman, you are expected to do this. The safest time to do this breast self examination is 3 to 5 days after menstruation. And the reason it's you're expected to do it at this time is at this time your breast is not engorged, your breast is not tender, and the rest of them. You understand? So 3 to 5 days after menstruation, you're expected to check, and it's also advisable, especially for menopausal women, to check their breasts the same day every month, right? Let's say you're checking your breast, you're doing breast self-examination on the 5th of every month, on the 5th. So you continue like that from January to December, 5th of every month. It helps you to keep in check. It helps you to keep track of when you are doing it and when you are not. So, going back to the breast self examination methods, I said the second one is manual inspection while standing up. So what you do is, let's use the left breast. So you are going to use your right hand for your left breast. You are going to raise your hand above your head, place your hand behind your head, and then you are going to use your second finger, your third, and your fourth finger, right? You are going to use the pad of your second, third, and fourth finger for this examination now. And there are various styles for doing it. You can do it circular method, you can do it star-shaped method, you can do it wheel spokes method, quadrant method, vertical method. But then the most common and the most understandable for everybody is the circular method, right? So what happens is, using those your pad of your three fingers, right? More like the palm of your three fingers. You are now going to massage from outside in, from your breast, starting from the upper part down to, remember that I said your breast also involves under your armpit. Down, you just keep going circular and be checking for lumps, checking for abnormal movements of things within your breast. You understand? So you just keep going that way, circular motion down to your nipple, and then you do would you feel for lumps, feel for thick spots or changes, and then check under the areola as well. Then squeeze your nipple just like you did before for discharge. Then the last is manual inspection, and then you're going to do this one. Remember, we did manual inspection while standing up. Now, the next you want to examine the left breast. You're going to place a pillow under your left breast, right? So your arm and your breast and that part of your chest at the back, that part of your back, sorry, is going to be on the pillow, and then your arm is under your head as well. So when you lay down, the breast tissue spreads more evenly, right? So it gives you more space to depict if there are lumps or there are no lumps. That's why, aside the one you do while standing up, you also do this one while lying down. Let's say you were not able to feel a lump. When you're lying down, you can be able to feel a lump if there is any lump, right? So you lay down, you put a pillow under your breast, and you place your arm behind your head. Using the pad of your 3 fingers, like I explained earlier, you press all parts of the breast tissue as well as under the arm. I know the reason why I'm still explaining this under the arm, because people still do not know that your under your arm is also part of your breast. So you do same for the other breast, and be sure to move to check under your areola as well as squeeze your nipple for discharge. So for visual inspection, you are checking for discharge, you are checking your nipple for engorgement and the rest. For the one you are standing up, you are squeezing your nipple for discharge. For the one you are lying down, you're squeezing your nipple for discharge, right? Because aside the breast, aside the one you clearly think is the breast, you also have your areola and your nipple. And remember I said for types of breast cancers, you have the one that involves the nipple, right? Yes, which we called Paget's disease of the breast. So in conclusion, just like I said earlier, prevention is the key to ultimate state of health and well-being. And if we are aware that, okay, there are things that you can do to prevent breast cancers, I mean, it can help a lot of us prevent or be well aware of what to do and how to report to the clinic, and then take various tests to prevent spread as well as spare our lives for better health. Thank you very much.
Thank you very much, Val. Thank you. Thank you very much for your lecture. I'm sure all of us must have learned one or two. Please, I think it's time for us to take questions. We've learned a lot. We've learned about breast cancer, breast self-examination, prevention. So please, anybody who has a question, please, can you unmute your mic and ask the question?
Good evening, ma'am.
Good evening.
Okay, thank you, Ma, for the teaching.
Thank you very much.
Please, ma, can you now answer my question?
What is not clear for you? You are
I
asking
said,
if your friend has breast cancer, or if
yeah,
she should do breast self-examination or
yeah, she
something.
did a self-examination. Then beneath the breast, she felt a thickening. What could that mean, please?
Okay, the advice I would give you to give her is to report to the hospital to undergo further tests, yes, to depict whether it's just a breast lump. Well, because it's painful, well, I cannot diagnose that, but going to the hospital and carrying out further examinations would tell us if it's just a breast lump or it has proceeded to being cancerous.
All right, thank you.
You're very welcome.
Okay, please, any other person with question, let's have it.
Good evening, Ma.
Madam. Okay, please, Charity, let's hear you first.
Okay, thank you, Ma, for the teaching. But my question is there any natural cure for this stuff apart from chemotherapy, radiation, and others? Is there any natural cure for it?
When you mean natural, what do you mean by natural?
Like, let me say, food plan, fruits or smoothies.
Oh, okay. Okay.